Good morning. My name is Jeff Stauffer, Community Relations Director with Elville and Associates, and welcome to our webinar today, the 10th in the Elville Webinar Series Wellness Series, titled Making the Most Out of Your Medical Appointments. I think this is a really great topic today, and we're looking forward to it very much. So how this will work today, if you're new to our webinars, if you are, welcome. We're glad you're here, and if you're a frequent attendee, we thank you as always for your support of our webinar series. So you as the attendee are currently in listen-only mode. However, we're always going to do something a little bit different here as we've done the past several wellness series events. As we want to make this as interactive as possible, we're going to unmute all attendees at various times during the presentation when Ellen and Michelle are looking for your feedback and thoughts. So while you can still post your feedback through the questions panel and the chat feature, feel free to speak up and let your voice be heard through your microphones that you have on your computers. You received the presentation by email yesterday from me for your convenience to take notes on it if you wish. If for some reason you didn't receive the presentation, it is currently located in the section marked Handouts in the panel on the right-hand portion of your screen to download at this time. Everyone will also receive a post-webinar feedback email right after the presentation. And I do ask that you take just a couple minutes to fill out this very quick survey to offer us your thoughts about the presentation. And if you have a topic in mind that you'd like to see us address for our wellness series or our standard webinar series, please let us know, and we will certainly take that into consideration. Elville and Associates here at the firm, we work every day with families, with clients, with the ideals of client education, collaboration, and compassion in mind. We're always available for consultations to discuss your family's planning needs and look forward to being a resource to you in any way, now or in the future. So at this time, I'd like to welcome back and turn the webinar over to our presenters, Ms. Ellen Platt of the Option Group and Dr. Michelle Fritsch of Retirement Wellness Solutions, who will share just a bit about themselves and get started with the presentation. So Ellen and Michelle, it is all yours.
Thank you, Jeff.
Thank you, Jeff. Again, we are so excited to be here for this particular topic because navigating healthcare has gotten really complex, and we've got some very specific tips for you. So thank you so much for being here. Ellen, you want to tell them more about you?
Sure, thank you, Michelle. I'm Ellen Platt, founder of the Option Group. We do private case management and advocacy, so we help people navigate their health care. We work with families that are struggling for the care of a loved one, and we provide services in Maryland, Delaware, and Pennsylvania. I'm excited to be here today, and I appreciate your time and attention, and we're going to hopefully give you some good tools and tricks on making the most of your medical appointments.
Absolutely. And I'm Dr. Michelle Fritsch. I was in academia for years until I saw people retiring and their health declining and realized it was preventable. So Retirement Wellness Strategies is for anybody nearing or early in retirement that wants a solid plan for health. And then during the pandemic, Ellen and I have created Propel Comprehensive Wellness, and we'll tell you a little bit more about that toward the end. Last month, we talked about social wellness. If you were here for that, I would love to hear from you. How have you addressed? What actions have you taken? What tidbits stuck with you in relation to social wellness? Would you put that in the chat or just speak into your microphone? There we go. Just as a reminder, these are some of the things that we talked about. Ways to address social wellness, ways to give back to others and get really engaged in things, learn new things. So does that jog any memories? Again, I'd love to hear what you took from that.
I think we have a shy group so far, Michelle.
All right. Please know Ellen and I love feedback. So at any time, we'd love to hear from you when you do have something you want to share with us. Get my slide to move. Here we go, Ellen. So health is multifactorial, and you've heard us talk about this before. But sometimes when we think the word health or wellness, we think about the physical parts. What diagnoses do we have? What medications do we take? But your health and your total well-being is so much bigger. It includes your mental health, especially in these last couple of years. Depression, anxiety have run rampant. Your emotional health, how are you navigating the highs and lows, the stressors, the news that comes at you? Your social health, which was our topic last month, but how are you interacting with others? Do you have that support network you need to really stay engaged with life? And then your spiritual health, whatever that looks like for you, it's an important part of who you are. And then you've heard us talk about purpose, and we're going to talk about that some more in future months. So any feedback on this or ideas around this concept?
Yeah, I just think it's a great way that you put it, Michelle, how all these different aspects, the physical, mental, social, emotional, and spiritual, all feed into health. They all impact health in some way. They're sort of intertwined. So it's really important to pay attention to each of those areas.
And we've had sessions on each individual one, or almost all of them, because they're so important.
So let's think about a little bit about how you prepare for healthcare visits. So think about the last appointment you went on, whether it was your primary care or cardiologist or neurologist. Your last appointment, think of the things that you did to get ready for that, if at all. And if you could just put that into the chat or speak it into your microphone, and let's give everybody, let's share our ideas on things that we did to prepare for our last doctor's appointment. If you have any ideas, just throw them in there.
And if you just showed up, you are not alone. I would say that's what the most of the people do.
Do we see anything in the chat, Jeff?
We have somebody that says, I wrote down a few questions. We have somebody that said, I did nothing. Okay, they're coming in fast and furious here. Hold on. Made a list of items to talk about and concerns. List of all meds being taken. Checked my blood pressure and pulse rate. Let's wait for another one or two here. Okay, that looks like that might be it for right now.
Those are good. So some of the types of things that we want to talk about today are specific steps.
Okay, we got one more from a really good client of ours. Completed intake forms, updated medication lists, reviewed medical history related to question.
Beautiful. Very good. We're going to go into each of these in a little more depth before we end today, but I wanted to give kind of an overview. We want you to get the most out of your healthcare visits. And we know, and the whole healthcare system knows, that it feels like time gets crunched more and more, the time that you get with each type of provider, and the demand for you to come in being ready to get the most out of that visit is so important. So we want you to know exactly how to do that by the time we're done. Making sure that all of the providers know every medicine you take and how you take it, because there's often a difference between the way it's prescribed and then the way that actually fits into your lifestyle. And it's really important for your team to know both, to understand why medication use and even other aspects of care can change as we age, as our weight goes up and down, as our body changes over time. And so we're going to go into that just a little bit. And just as a tidbit, some things that you want to review with your primary care doctor at least once a year is your kidney function and your liver function. And so in the parentheses, if you're looking at your lab parameters on your portal or in the printout that you get, these are the ones that indicate how your kidneys are working and how your liver is working. They have very long names that you probably don't care what they are, but they put the abbreviations typically on your lab report. So I wanted you to know what to look at. Don't want you to get alarmed when you see the numbers, but rather they're a great focal point for a discussion with your doctor. Because as our kidney changes and as our kidneys change and as our liver changes, medicines need to be adjusted. And so we want to make sure that you're taking a close look at that at least once a year. And then understand how medications can impact things like safely walking and driving. We've talked before, and we will talk again in future months, about how if you feel like you're fuzzy thinking or your response times are slower or your memory is slipping, a lot of times that's medication. And so again, asking those questions with your healthcare team can help get rid of the medicines that are causing those sorts of reactions, allowing your brain to be really sharp. So that's a lot of hodgepodge of stuff put into one slide. So we're going to break it down a little bit. I'm a pharmacist. We have to talk about this. Who knows everything you take? And I heard some of you mention that you take a medicine list or you fill out the medicine list when you get to the doctor. Pretty much all of us include our prescription medicines. Make sure that includes what your primary care doctor gives you as well as all the specialists. But on your medicine list, do you include your vitamins? Because they can be very important. Your over-the-counter medicines, even the once-in-a-while ones. So maybe you only take this when you get a headache or a stomach ache or a cold. But you want to make sure that your doctor and your pharmacist know those medicines to make sure that they're safe together. How about supplements? There are so many things on the market that you can choose to take by yourself. So it's easy to forget about them when the doctor is asking about medicines, but I want you to include all of them. How about herbal therapies, naturopathic therapies, even tobacco that you consume, holistic therapies, and marijuana or CBD. You probably know that recreational use is going to be on the Maryland ballot in November. So it's currently legal for medical marijuana purposes. It's anticipated, reasonable likelihood it'll pass for recreational. So we want to know about that too, because all of these things are substances. They may not be what you think of as medication, but they are all substances and they can all interact. And so when you talk about taking a medicine list to your doctor's appointments, I really want to encourage you to include all of these. So is this a good point to take a little pause? Any feedback about this? Is this something you're already doing? You might have heard me tell this story before, but it's the one that just solidified how important this is in my brain. It was a woman in her 80s who lived alone. She had a little dog. She did great, and there were no limitations. And every evening she would take her dog out for the final time before retiring for the evening. And she had 3 episodes over the course of a year where she took her dog out and got very confused and couldn't even remember which house was hers to go back to it. So neighbors would find her and call 911. And it took 3 different times before a team of us kind of really dug deep as to what was going on. And it turns out when she had those evenings where you're just restless, or maybe you're in pain and you just can't settle, she had 3 different medicines that she would take just on those rare occasions. And if she took any 2, she was fine. It was only the nights that she took all 3 together that it would basically shut down her clear thinking and cause her to be confused out in the street in the evening, and she couldn't get back home. But these were not the kind of medicines that were on her medicine list, because she only took them once in a while. I mean, it was only 3 times over the course of a year. So her doctor didn't know about them. Her pharmacist did not know about them. So nobody was in a position to say, ooh, if you take those together, that's dangerous. So it's the best example I've seen of why it's so important to include all of these. Are there any comments, Jeff? All right. If not, we will keep going.
I'm sorry, I was on mute.
Okay.
We just got a comment stating include caffeine in feedback to doctors, amount of coffee, tea, chocolate. That's a question.
You know what? If it's kind of your typical caffeine, not so much, but like if you have high blood pressure and you drink 10 cups of coffee a day, definitely it's relevant. Or if you drink any of those energy drinks, which I do not recommend ever, 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 but if you do, that's a lot of concentrated caffeine. It can impact your brain. It can squeeze down your arteries, which can have impacts in your brain and in your kind of your heart vein systems, and it can definitely raise your blood pressure. So if you consume a lot of caffeine or you wonder if it's a lot, then yes, I would mention it. One other piece of that, and the data is not as clear, but women that get a lot of breast lumps and cysts, there's mixed data as to whether increased caffeine increases the risk of those breast cysts, especially if they're painful. So if you have those cysts and they hurt, consider reducing your caffeine and see if that gets better.
Great. So as we're starting to prepare for our healthcare visits, not only making a list of the medications and supplements and over-the-counter medicine like Michelle was talking about, we also maybe want to think about, see if we have any questions about how to take it. Should we be taking it with food? Should we be staggering it with other medications that shouldn't be taken at the same time? Other things you might want to think about is the time of day. And the example that I can give for that is I had a gentleman that I worked with who had been given a pill for fluid. And he was taking it right before bedtime, so he was up all night going to the bathroom. And so we simply were able to adjust the time of day. And so he had a good night's sleep, but the fluid was still managed. So just things like that. If there's a reason, and maybe Michelle, you might have something to add to that, the time of day, the type of food that you take it with, the other medications you take it with.
I do, and a piece of that is like if you take thyroid medicine with your breakfast, you get a lot less benefit than if you take it on an empty stomach. And if you take anything for osteoporosis to build your bones, the timing of that medicine is everything. If you have Parkinson's disease, the timing of those medicines is everything. Another thing I sometimes see is if the medicine is like 2 or 3 times a day, sometimes people think, well, I'll just take it all at once. And then you don't get the benefit because the medicine only lasts for so long. And so you get a whole bunch of medicine effect at the time you take them, and then nothing to cover you the rest of the day. So sometimes that all seems like pesky little details, but I encourage you to pay attention to those, or at least to ask those questions. Is this one important, or is it just kind of a recommendation?
Great. Something else you might want to think about when you're getting ready to go to a doctor's appointment is thinking about any new symptoms or concerns, maybe something that came up over the last week that was just a little bit different than normal for you, or you started noticing a symptom or some gnawing pain or something like that. And so kind of tracking that and noticing what's different since you were last there to at least have a discussion. It may or may not be something to worry about, but at least, you know, getting it on the radar screen and having the physician take a look at it to say, yeah, let's watch and wait, or he might have some other, or she might have some other suggestions. So that's one thing that you want to do, symptoms or new concerns, but also tracking as much detail as you can, because as specific as you can be, that gives the physician more information to make an informed discussion about it.
Right.
Did you want to add anything to that, Michelle?
Well, and I would say an important piece is when you get all of that kind of written down or pulled together and prioritized, there's an advantage to taking 2 copies. And if you're really good at typing on something small like a phone, which I am not, you can do that. But I personally will take paper, and then it gives you a place to take your notes. You want to make sure that before you leave that office, you really understand what the doctor is saying to you. You've had a chance to write it down and kind of think about it, make sure you understand it. But that second copy, you know, the medical assistant that takes you back and gets your weight and your blood pressure and that kind of thing. If you give the second copy to that person and ask them to put it where the doctor can see it before the doctor comes in, it allows that doctor to be fully aware of why you are there, what you want to talk about, and what your priorities are. We mentioned earlier that it feels like healthcare is moving so fast. So if you only have a limited amount of time in your visit, you want it to be super efficient. So by having all of this documented, it allows that to happen. It saves a few minutes off of the front of the visit where the doctor's trying to fish for why you're there and what's going on. You've just made it super clear right from the start. Is that making sense to everybody?
We do have a question, Michelle. It says, my father is in his 50s and does not go to the doctor because he's afraid of hearing bad news. The family has a history of some serious diseases as well. Any thoughts about that?
I understand it. Ellen, you often talk about that second person. That seems like a good response to this.
Yeah, a lot of times, I mean, the work that we do, we go along with our clients to a doctor's appointment because it's really important to have another set of eyes and ears in the conversation. That way that, you know, after the appointment, if that person forgets what they were talking about or just felt bombarded by so much information, there was another scribe or somebody who heard the information, kind of put it into context or remind you the content that was discussed. And that's also a good time that if you didn't quite understand it, making sure that you do instead of worrying over time. It's great to have, you know, a loved one, a family member, a care manager, some type of professional healthcare advocate go with you to be able to kind of capture the information, but also store the information for future appointments or referrals to specialists and things like that. But at least it's a place to kind of house all that information so that you can understand it better.
Yeah, and encourage you to never leave the doctor's office until you understand. Sometimes it's like an accent or the pace at which the doctor talks is hard for you. Every doctor I've ever worked with, and it's a lot of doctors, they would love to bring somebody from their staff in to help explain what they're saying to you to make sure you really get it. Because we all know how hard it is to get home and then try to call back and get our questions answered. By then, that doctor's seeing other people, you know how fast they have to move throughout their day. It is so hard to get back in touch. So make sure you stay and really understand the answers before you go.
Good point.
One other thing I want to mention related to your dad and kind of being afraid to go in. Just in the last few days, I talked to somebody who had some new atrial fibrillation is a way that your heart beats out of rhythm, and it can come and go and come and go. And that's what was happening to this person. It would come and it would make it hard for him to breathe and make him feel really tired, but it only lasts for a few hours. And then it might be a month or two before it happened again. But he was thinking about his heart, and he went in, and when he looked at the record that you get after your doctor visit, it said bradycardia, and it sort of made him upset. He was like, I don't know what that is. That scares me. I Googled it, right? I looked at it online. It's about my heart. I'm scared. I don't know what that is. And we were able to talk through it. This person is extremely fit. He was a long distance runner for years. His heart rate is naturally slower than mine will ever be. And so bradycardia means he has a slow heart rate, and it's a big word and it looks scary, but it is normal for him. And so we were able to talk through, he doesn't get dizzy when he stands up or moves. He's a very, very active person. His kidneys are fine, which we could go into why that's important, but that's another indicator of whether his heart rate is too slow. It's not. And so sometimes we get worked up over things that are said or written in our charts that we don't understand, and that might a little bit be the case with your dad. I would encourage him to have somebody around who understands healthcare that can really break it down and explain it and help him feel like he can ask all the right questions when he does have a doctor visit.
Mm-hmm. Another thing I'd like to add in this scenario too is throughout our lives, there are certain time markers, like when we hit our 40s or when we hit our 50s, there's preventative screenings that are also often recommended. So your father may be missing some of those. When you hit 50, often the first, baseline colonoscopy is ordered, and that is preventative. So it's not saying you have a problem, you have an issue, but it also gives you the ability to be proactive with your health and be able to address concerns early on rather than letting them progress and get worse. So that's also another important reason to kind of follow up with primary care physicians and go to appointments, not to be scared of finding something, but maybe being proactive in avoiding finding something down the road. So that's something else that you might want to consider. You also want to consider what other physicians have you seen recently that you need your primary care to know about. So if you went to your cardiologist, or you went to your urologist, or maybe even an orthopedic person because you had a joint pain or something, you want to make sure that you convey that information. And electronic healthcare records may not be connected, or they may be different hospital systems, and your primary care may not even be aware that you were seen by somebody else, or prescribed something by somebody else, or recommended to have blood work or imaging or screening. So it's really important as your own healthcare advocate to make sure that the primary care is going to be the center of all this data so that they'll have that available.
Absolutely, that is so important.
Yeah. Other things you might want to...
I'm sorry, we had a comment from one of our good friends of the firm here saying that in addition to writing down the answers to questions, I sometimes record on my phone the conversation with my doctor to play back later.
Certainly ask your doctor's permission, but I'm finding more and more are comfortable with that because they know that it's going fast and they want to make sure that you really heard the answers. So I like that when doctors are comfortable with that.
Yeah. Also, other things that you want to take to a primary care physician appointment is if there's been any changes in your advanced directives, or if you have a new power of attorney, somebody who's going to make healthcare decisions for you. It's really important to communicate that to the doctor. Any changes in your lifestyle? Has there been a move? Are you no longer driving? Do you have a caregiver coming to help you out 3 days a week because it's difficult to do those activities of daily living that you need a little bit more assistance. Those are really important things to share with your primary care. And some physicians like you to keep logs. So for example, if you have diabetes and you need to track your blood sugars, and then you take the log into the appointment and they can look and see if they're consistent. That's really important to take those kinds of things if you are doing that, if you're tracking your weight or you're tracking therapeutic levels of a medication, you want to make sure that you have that. And then there may be a chance that you may feel that you need some patient education. So you're new with diabetes, you think you've got this handled, you're tracking it really well, your numbers seem to be stable. But if you're feeling unsure about, are you doing everything you can to manage that the best you can, this is a really good time to ask those questions.
And maybe get a referral to a dietitian or to an exercise therapist or somebody that could help you better understand the specific details of what the doctor wants you to do. It's a great point.
Mm-hmm.
All healthcare providers, PAs, nurse practitioners, physicians, pharmacists, we all learn a set of questions to ask when there's a new symptom, something new is going on. So if you think through these questions before you go to the doctor visit, even have them on your written thing that you're going to give the doctor, talk about saving time and getting quickly, helping the doctor get quickly to the answer of what tests to order or what's going on with you. It's whatever your symptom is, where is it, when did it show up, does it stay in one place or does it move around, what do you think caused it, what makes it better, what makes it worse, what have you tried and has it helped? And then how does it make you feel? Is it impacting your day? Is it causing you to no longer go out of the house? Is it just a minor nuisance? You know, how big of a deal is it in your life? And so I just think it kind of empowers you to know what questions that we're all going to ask and already have thought about your answers to those things. And along those lines, let's say it's pain. There are so many ways to describe pain. So Ellen mentioned the details. This is one of those areas, whether it's a stomach ache or a sore foot or whatever. How would you really describe it? We find a lot of times when tests are ordered that aren't necessary or just aren't looking at the right thing, or a diagnosis is made that's not correct, it's usually because the doctor making those decisions doesn't have the whole picture. And so one of the best ways we can advocate for ourselves as individuals is to make sure that our doctors know everything that's going on, so that as they make decisions and try to figure out what's going on, they've got all the data they need to do that correctly. Any questions or comments? All right, onward we go.
We do have a comment here. A couple here. I have my blood work done prior to my primary care appointments. Interesting idea. Thus, I can review my blood results with my doctor.
Very good idea.
So what we want to do is also think about who are the members of our healthcare team. And of course, the primary care is usually the center of your team along with you. And I want you to think of it as a collaborative relationship. It's not the doctor telling you what to do, but it's really should be a collaborative relationship, and you ask questions and clarify things. But there may also be other parts of our healthcare team which are important in some aspects and are going to feed into what you and your primary care physician are doing. So it might be any number of specialists, could be a pharmacist who's reviewing medications, maybe a dietitian to help with nutrition, physical therapist to help with some type of joint pain or orthopedic or functional disability or limitation that might happen from either just aging or some type of condition or injury. naturopathic physicians, chiropractors, these are more holistic wellness kinds of things, massage therapists, dentists, optometrists, ophthalmologists, and healthcare navigators. So somebody who may not be providing you services, but helping you navigate that healthcare system, and caregivers who may be helping us, whether they're family caregivers or professional caregivers. They are around a lot and seeing how you function and maybe helping you with things. And they may have some good information to be able to share.
Yeah. Something I've been talking a lot about in health professional schools is it feels to me as healthcare, it's changing. The pandemic has changed our healthcare system so much, but it feels like more and more people are, I call it fragmenting. So if you picture a rope and all the strands are being pulled loose, they're going off and doing their own thing separately from each other. And I really believe your best healthcare comes from interprofessional or integrated care, where all the pieces of your team are working together and making sure that together they're making the right solutions for you. It's not the standard of practice right now in most places, so we want you to think of yourself as the one that pulls your rope back together and feel like you've got the power to do that, to make sure all those pieces, all those people that are the pieces of your rope are coming together and they're all working from the same complete set of information and they're all completely updated before they make any decisions about you. Which is exactly what this slide says.
Yep, keeping them updated. We talked about before, sometimes electronic health records aren't communicating between hospital systems, or the primary care physician just didn't have time to go into the portal to look and see. So it really is making sure that we are collaborative, that we're sharing and talking to the physician and bringing them up to date. But by doing so, you're going to be coordinating your medical care, which is really important. So you're not duplicating tests. You're not going back for more blood work when you just had it the other day. It's really coordinating those efforts, making sure that they're aware of changes, hospitalizations, update them on any changes in medication or changes in weight or changes in symptoms, things like that. It's just really important to let them know, even changes in your activity level. You've been lethargic. Think about mental health too. I mean, have you been sad or despondent? Those are also important to share. Even if you've not been to see a psychiatrist, it's still something important that you want to share with the primary care physician, because as we said at the beginning, all those different aspects of your life feed into your well-being, and we want to make sure that we're looking at all aspects.
Great point. So Ellen, you've used a lot of ologist words. Let's go through these. Who are all these ologists? Because sometimes the words get thrown around and I don't know that we always really know what each one does.
Yeah. So cardiologist, I think a lot of people know about that. It's relating to the heart.
The endocrinologist is, I think of hormones, but diabetes is one of the biggest things that they help with. Any changes in your thyroid and other hormones.
Pulmonologist is relating to your lungs, your respiration, your ability to breathe.
Yeah. The neurologist is about the brain, and especially if you feel that your thinking has changed and the sharpness of your thinking has changed, there are certain things your primary care doctor can do to kind of clear that up. But if that doesn't work, then the neurologist would be the next stop.
And then a hematologist is really relating to the blood. So you see that sometimes with blood cancers or other blood health issues, and you would go to a specialist.
Mm-hmm. And then we probably all know that the oncologist is cancer. And there are some oncologists that are sort of generalists and treat a number of different cancers. But there are a lot of oncologists that focus on specific types of cancers. So if you find yourself in a situation where you need an oncologist, do some research, talk to your current physician network to see who might especially be up to date on your type of cancer?
Rheumatologist really focuses on arthritis, autoimmune diseases, connective tissue diseases, things that are a little bit outside of the ordinary, but is usually typically a systemic type of disease that really has special considerations with treatment.
Yeah. The orthopedic doctor think bones and joints throughout your body. And when there are issues with bones and joints, then that's the doctor you see. I gave you this big word, Ellen.
A gastroenterologist, and that really is upper and lower GI tract. And so we're looking at the stomach, the abdomen, the bowels, esophagus, everything from beginning to end within the food journey.
Exactly. You know, we've covered a lot of these things, but there's even more data. If you're going to keep all of your information together and be able to share it with your team, here are some additional things. And Ellen, you've mentioned most of these, but a few more.
Yeah.
And right now, we know vaccinations is a big deal. Whether it's your shingles vaccines, your pneumonia vaccines, your flu vaccines, now your COVID vaccines, maybe very soon your monkeypox, which is about to change names, vaccine. So that aspect of our healthcare seems to be rapidly growing right now.
We have a comment, Michelle and Ellen, from one of our attendees, and it's a tip. And the tip is, when a physician prescribes a new medication, ask him or her what are the possible side effects.
Absolutely. And ask that very same question at the pharmacy when you pick it up. That's good. Do you currently have in a place where you can easily share it with your doctors or people in your life who might, let's say that you've got something going on where you can't speak for yourself? Is there somebody that can speak for you who knows name and contact of everybody on your healthcare team? Just kind of put in the chat, yes or no. I've got that all pulled together, super organized, and everybody knows where it is. I know I've been in one doctor's office before, and they're like, well, who do you see for this? And what's their address and their phone number? And I'm scrambling, you know, to find it, to give them that information. So I know it's important, but I haven't quite gotten it organized myself.
We have a couple no's, we have a yes.
Good.
I would be in the no category.
Well, that's your homework for next time, Jeff.
I am learning a lot. I am taking notes.
Ellen, thinking about what you all do, maybe describe for us when you walk into a crisis, just how important this would be and how different it would change your next steps.
Sure. I mean, there have been times where we have walked into somebody's home that we're providing care for, and we realize that they're just not, something's not right. And, you know, it's great to have the primary care physician right there so we can make a phone call and run the concerns past them. If we need to take them for evaluation to the emergency room, something like that. Or if there's just a question about, did you have this done? Or there's confusion. Sometimes folks that we work with are having some cognitive issues and they just can't track all the details. So to be able to quickly contact somebody, for our regular clients, we usually gather this information for this very reason. But if it's somebody new that we're working with, gee, it would really be nice to have that sometimes, because we do run into situations where you need that information quickly, or family members would like to have that information quickly. So it's great to have that, you know, magnetize it to the side of your refrigerator, keep it in your purse or in your wallet, so if you ever needed to pull it out, and really important to give it to your primary care physician. They could just put it in the chart and that information would be available to them. So if they need to collaborate or talk about medications or get results of testing that was recommended by one or the other, again, it can get back to that primary care physician.
You know, sometimes people think, oh, these sorts of decisions of who can speak for me, who's allowed to make decisions for me, who has access to my information. I've heard people say, oh, well, I'm not old enough for that yet. It's not an age thing. I'm just thinking about in the last week, a friend's 18-year-old daughter was taken to the emergency room unresponsive, and there was nobody right there who knew all of her information and could share it. You know, it happens at every age. I went hiking last weekend and fell, and thankfully was not hurt, but just as easily could have smacked my head, and somebody would have needed to speak for me. So it's not an age thing. It's a great preventative decision-making process to decide who are you going to keep updated to speak for you, and who's going to be able to make decisions. I was talking to a couple, it's been a few months ago now, but they're like, oh, our 3 sons will do it. And I'm like, and they're all adults. I'm like, when's the last time they agreed on anything? And they started laughing and realized they can't leave it to the sons to try to figure it out in an emotional time. You know, they needed to identify who among their sons would be that primary decision maker.
Point.
We have another question here.
Uh-huh.
It's a good question. I'd expect a good question from this person. Hi, Roseanne. Regarding vaccines, my mom is adamant that she received her shingles shot at a local Rite Aid, now Walgreens. We called to confirm, and neither store can find the records. Is there any place that all vaccination records are reported that we can check?
I don't believe so. Wouldn't that be brilliant? And I think the day will come, but not that I know of yet.
Okay.
There's a national repository of vaccine adverse effects. So like if someone has a vaccine and feels like it caused something, there's a repository of that. But just when and how and where people received vaccines, that's separate from that institution that gave it. It's not that I know of. It's a great idea. If you want to make your millions, that might be the way to do it.
We have a comment related to that from another good client. It says there is a Maryland website that has a list of vaccinations, maybe MDIR. So just a thought from this client.
Good. I'm going to write that down also.
Thank you, Pat.
So we've kind of talked about this, that having all of your data updated and in a way you can share it is super helpful in all aspects of coordinating your care and allowing you to really make sure the very best decisions are made about your care. And there's some ways to do it. You could have it on a file on your phone. You could keep it on your computer and print it off. I've had countless people just keep it on a piece of paper they carry in their wallet. And it's certainly a big part of Propel Comprehensive Wellness that we do with clients, that gives them a HIPAA secure, like a really secure place to keep this information, keep it updated, and then they can be traveling anywhere in the world. And if something happens where they need medical care, they can pull it up again from anywhere, as long as there's internet, and share it with any local providers. So does everybody have that? Do you feel like you've got your information pulled together, or has today kind of given you some incentive to maybe more completely pull your information together? Remember, you can
From
come on your
the
mic.
from the comments that we've had that have been just continual throughout, I think this has been extremely helpful for a lot of people, certainly including myself. But going back, looking at the comments, they've been just continual throughout. So I think everybody's been very engaged, and it's been very helpful to a lot of people, in my opinion. So let's
Excellent.
see here. Just looking here, definitely helpful, great information. Thank you. And then also we have a comment. I do not have it all centralized and readily available, related to your last comment. And then another comment, I have it, but not in one location. And then related back to the vaccination records, the website is myir.net, just for anybody interested, especially Roseanne, the person that inquired initially. So my as in yellow, ir.net.
So helpful. Thank you.
This has been very helpful, especially when you are caring for seniors. Thank you.
Yeah.
A couple of other things I'd like to mention, particularly when you're dealing with seniors, is the day of tends to be a very kind of stressful time. You've got to get out the door and into the car and to the, to the parking lot and find parking and get in and help navigate to where you're going to go to the doctor's office, and just allowing a little extra time to get there so that you're not coming in harried and discombobulated, that you're coming in, might have a minute or two to just do some deep breathing, like we've done some exercises in previous educational seminars, but also just taking off the pressure and the stress of getting there. A lot of times people go into a doctor's appointment very stressed. Their blood pressure is much higher than it normally is, and it just allows, that extra time allows you to kind of get there and get settled and feel more ready and prepared for the doctor's appointment.
Good point. Very good point. This is just our visual that you are the bridge between all of your physicians, all the other people on your team, that especially in today's healthcare environment, feel free. It's highly encouraged that you be really proactive and pull everybody together. Be your own source of all the correct, up-to-date information. Ellen, you'd mentioned that, the more relaxed we are going into a doctor visit, certainly the more thoughtful we can be in the sort of that front part of our brain. We can listen better, we can absorb better, our blood pressure is going to be lower. Were there other things you wanted to add to that?
Just like we talked about, just allowing extra time, if you need to use the restroom before you go or when you get there, and just kind of going inward, just doing some deep breathing exercises. The purpose of going to the doctor is to take care of yourself and be proactive with your health. So we want it to be, a good experience where you're remembering all those things you wanted to talk about, but you're also able to receive the information that you're getting from the physician. So you have a really good understanding of what the recommendations are and where do we go from here.
Great point. So as we wrap up, we want to offer to you, explain why we have collaborated on Propel and allow you, or give you an opportunity to check it out to see if it's going to help you as you navigate and have a really rock solid plan for your health moving forward. Throughout our combined 60 plus years, we have seen too many people that seemed fine, and then they left their primary occupation and their health declined rapidly. Their relationships fell apart. They lost their sense of self-identity because it was wrapped up in their job. And it's for that reason that we realized we had to take action and do something to help people come up with a solid plan for health and purpose, ideally before they retire, but early in retirement can be helpful as well, so that that next phase is fulfilled and vibrant, and you've identified purpose in that next phase. And so again, we spent the pandemic creating this. It's a monthly subscription where you're not overwhelmed by information. You get a little bit of short videos and a workbook each month, pulls together all these components of health and purpose that we've talked about. You can meet with us one-on-one anytime. And we just want to offer it to you to check it out and see if it's right for you for just $10 by being an Elville client. So it's propelyourwellness.com, and if you use the code Elville, then you can try it for just $10. We'd love your feedback. It's designed to address so many of the issues we've seen in today's healthcare and in the lives of people who retirement didn't turn out to be what they wanted it to be, but we know that it could have been prevented. It could have been what their dreams were about. So we are so grateful to be here, Jeff, and everyone. Glad to take some more questions. Here are ways you can reach us.
Great, thank you very much, Michelle and Ellen. Wow, this was, put my camera back on here. This was just a great topic and discussion. I'd like to thank both you and Ellen, both for some great feedback and thoughts, and our attendees for interacting and sharing their thoughts. It really just helps make for a great discussion, an hour. So I knew that when we came up, or when you came up with this topic, it would really, I think, resonate with a lot of people, and I think it did. So thank you so much. So I have some information. Some people were asking, they typed in that website address and it wasn't working. So I just typed in a little bit of information and did find some information that I think might be useful. I won't go into it because we're getting up to 12:30, but so I found out it says as of October 17th, 2019, through the Maryland Department of Health, Maryland Department of Health launches portal to give parents access to vaccination records online at no cost. Maryland Department of Health today announced a new portal that will enable Maryland residents to access vaccination records online at no cost. Users will be able to view and print official copies of their vaccination records and those of their family members on demand via md.myir.net without an additional request to a healthcare provider. And I will send a link, this link that I just found online, to everybody in my webinar email follow-up, so you can take a look at it and look into it further if you'd like. So I'm gonna actually save this for myself. So I hope that's helpful to you. And let's see if we have any other questions. Doesn't look like we do. So if you do have any final questions, now would be the time to get them in to Michelle and Ellen as we wrap up. So as I always do, I'll be sending out some information to you that I hope will prove helpful. The video for today, as well as the slides, if you would like them again or didn't receive them the first time. As for our webinar series, we're certainly ramping up again as we finish up the summer, which is hard to believe. So next Tuesday, the 23rd, we have a business planning webinar for the business owners out there. Expense versus capitalized, tangible property regulations. So kind of a specialized webinar, but a very important one for our business owners out there. Also Friday, the 26th, we have our estate planning and elder law essentials offered by Stephen Elville, our managing principal here at the firm. And then Tuesday, the 30th, knowing the differences between assisted living facilities and skilled nursing facilities. So interesting topic that our senior principal and elder law attorney, Lindsay Moss, will be talking about. And then next month for our wellness series on the 20th, staying mentally sharp. And we're going to be talking about, let me pull up our description of that real quick. How fast I can get to it.
We're going to work on ways to keep your brain really sharp and help you overcome the things that can sometimes change that, and then we'll learn how to fix them.
Yes, there are strategies you can take to keep your brain always working and learning. We will cover these and steps to take if you're feeling your memory is slipping. Get specific tips you can apply right away to stay mentally sharp. So that is what is up with our webinar series, and we're looking forward to seeing you again soon. And it doesn't look like we have any further questions. So Ellen and Michelle, thank you again. And for all of our attendees, thanks for being part of our webinar series, and we will see you again soon. Have a great day, everybody.
Bye.